So what do you need? An objective test. We use spirometry, and it's great. I have the nice situation where we have a big, full-functioning laboratory literally down the hall from our clinic room, so we have access to this all of the time. Now, severity mismatch between asthma symptoms and spirometry. Again, it's the same theme, but this is a study very nicely done by Michelle Cloutier and her group in Connecticut. They looked at about 900 children between the ages of 5 and 19, and they did asthma severity, and they based it either on a questionnaire, which is the questionnaire of basically, are you coughing at night? Are you coughing with exercise? How long are you coughing? Are you feeling short of breath? And then they actually did spirometry. And what they learned from this is if you did clinical criteria by itself, just ask those questions, this is the breakdown of intermittent or mild disease, moderate disease, or severe disease. If you did, in that same population, if you did spirometry, there's this dramatic increase in both the moderate and severe category. These suddenly became much larger. So the conclusion from this study is that we were under-diagnosing the severity of asthma in about 36% of these children. So does that matter? Well, it does. Without spirometry, providers often overestimate the degree of asthma control. The consequence of underestimating the asthma control, suboptimal treatment, increased morbidity, they just have more symptoms because they're not adequately treated, increased costs, more urgent care visits and more ED visits, and the quality of life is clearly decreased because they have higher symptom burden. So what do you do? So if the spirometry is normal, and that's actually very common for us, child comes in and you're considering the diagnosis of asthma, you do spirometry and it's completely normal, maybe their chests are clear at the time, but this is when they're well. So one of the things you can do is a provocative test. The one we do most commonly is exercise. We do have a formal treadmill. You can do exercise studies on the treadmill. You don't actually need a treadmill. The exercise could be anything. As long as you can get them to elevate their heart rate and exercise for 6 minutes, you can do anything. And then what we do is we do spirometry. I'll show you shortly the algorithm for this. You do spirometry, we have them exercise, and then we repeat the spirometry. The other thing you could do is you could do methacholine. The difference between these, exercise, pretty simple. They just need shorts and sneakers and have them run. It's very specific. So if the test is positive, asthma is very likely. In the cases where you've even done exercise, and the exercise study is completely normal, if the question is still lingering, does this child have asthma or really need to exclude it, then we do the direct test. The direct test is with methacholine. So they inhale methacholine, which is a bronchoconstrictor. And if you have asthma, you're going to constrict at a really low dose. And I'll show you that in a moment. So here for exercise-induced bronchospasm, it occurs in about 90% of children with asthma. Increased ventilation during exercise results in water loss, induces mast cell and eosinophil activation, releases mediators, it induces bronchoconstriction, and results in airway, smooth muscle constriction, mucus release, and airway edema. And how this works, again, you do the exercise, you do spirometry, you do the exercise, and then repeat it at intervals afterwards. We're looking for about a 10% reduction in FEV1, and then you treat them with albuterol. It's always important to remind yourself that you're going to tell the families before they start, yes, you're going to induce bronchoconstriction, but you're going to give them albuterol, and they will return to baseline, and they'll be fine to leave immediately after the test. So the methacholine, it directly stimulates the bronchial smooth muscle. So again, similarly, you start with spirometry, give them increasing concentrations, so we start at the lowest dose, do spirometry, double the dose of spirometry. We keep going, and what we're looking for is a 20% drop in FEV1, and that's the point where you'd stop the test, and again, give them albuterol, and they return to baseline. And a negative test, if you go through all 5 challenges and you don't have any constriction, the likelihood of having asthma is extremely small.